Can we put our hands together as we welcome the first presenter who will be taking us through exploring the challenges and innovative approaches to improving maternal health outcomes in Zimbabwe. That's Ms. T. Jonga. Can you put our hands together for her?
Good morning, ladies and gentlemen. My topic is on the challenges and innovative approaches in improving maternal health outcomes in Zimbabwe. So, maternal mortality is a public health challenge in the whole of sub-Saharan Africa. Complications like preeclampsia, hemorrhage, and obstructive labor are the leading causes of maternal death. In Zimbabwe, there are many things that are being done in order to improve maternal health, but despite these efforts, there are still some systemic gaps that lead to the poor management and detection of high-risk pregnancies. This can lead to adverse effects in the end. So the maternal mortality ratio in Zimbabwe is reduced from 960,000 deaths per 100,000 live births in 2010 to 362 deaths per 100,000 live births in 2019. Although this is an improvement, it is still far from the SDG goal, which is aiming for 70 deaths per 100,000 live births by 2030. Okay, so the aim of the study was to assess the impact of obstetric ultrasound on maternal outcomes, to evaluate the health system capacity and worker competencies, right? Okay, so I used the descriptive cross-sectional study and retrospective review from January 2024 to June 2025. And I looked at 3 district hospitals and 5 rural health centers. The participants were 600 pregnant women and 45 healthcare workers, and I used a convenient sampling procedure. Then the inclusion criteria were women were trained midwives, and the exclusion criteria were those patients with incomplete records. Since I used a retrospective study, I needed complete records to come up with accurate results. So the results showed that facilities with functional ultrasound services reported a 27% increase in timely referrals for high-risk pregnancies and 19% reduction in intrapartum complications compared to those without such capabilities. Okay. Then midwives trained in obstetric ultrasound demonstrated diagnostic accuracy in critical complications like FGR, preeclampsia, multiple gestations, and placenta previa. However, persistent challenges included equipment shortages, inconsistent maintenance, and insufficient opportunities for continuous professional development. The study concluded that integrating obstetric ultrasound and routine antenatal care enhances early detection and referrals. In order for us to meet the SDG Goal 3.1 target, we have to scale up equipment procurement and training of healthcare professionals in obstetric ultrasound. Standardized ultrasound protocols are also recommended to be included in national guidelines. We have recommendations. We have to expand midwife ultrasound training programs, ensure sustainable procurement and maintenance of ultrasound clinics, and embed ultrasound protocols into national health policies. Further research will be needed on patient perspective and implementation strategies on low resource settings. We also have to conduct cost effectiveness and patient-centered studies. Thank you.
Excellent. Thank you. Thank you for setting the ball rolling and keeping to time. So we'll reserve the questions. Probably are there any quick questions since we have a little bit of time? Any questions regarding the that research?
Thank you so much, Mr. Zanga. Thank you, Ms. T. Jonga. T means what? Tanyarazo. Thank you so much, Tanyarazo. But Tanyarazo, maybe do you want to show your results again? Because what you concluded in the results, they didn't match to me. So I just want to see your results. The slide. If we can go back to the slide, I just want to know what you found out. I was expecting to hear some innovations, serious innovative work from the topic. I didn't hear that. So you wanted to explore the challenges and the innovative approaches to improving the maternal health outcomes is your title. Okay, then let's go to the results. So what did you find from the results? Maybe we can just try to simplify to everyone what you found from the results. Or maybe describe a little bit more what you did so that we can believe your conclusion. Yeah, maybe she can go to the front so that...
Okay, before, yeah, you can go to the front of the Tanyarazo. I just want to explain that Tanyarazo's study is sort of a follow-up on the national training that we did for the district hospitals and provincial hospitals, training midwives, district medical officers. So I think she sort of did a follow-up on that, and her results are showing that that training actually made a difference, and the outcomes are actually improving because the midwives are now more experienced in picking fetal issues and referring them to the next level of care.
Yes, that's exactly what I was doing.
So do you want to explain a little bit? Do not worry, Tafaja. We want to improve your work because we think you did something amazing. But we just want you to explain a little bit more. What did you do? You looked for what kind of information? What kind of data were you looking for? And also, what outcomes are those? Which are just written maternal outcomes. What are those outcomes?
Okay.
You want to really unravel them.
Okay, so I was looking at, I was comparing facilities with functional ultrasound equipment, facilities with trained midwives, to see the rate of maternal mortality, and early detection of critical complications of pregnancy, like multiple gestations, preeclampsia, and hemorrhage, to see if those facilities that had trained midwives could detect early these complications, and compared to those without trained with midwives, could see how long did they take to detect critical complications like those. And then for maternal outcomes, I was looking at maternal mortality after the whole thing.